is Cassidy, and I'm going to be completing a head-to-toe assessment on a newborn infant. First, starting with hand hygiene, and then we would continue to assess the head. You would feel for the sutures, and then you would also feel the fontanelle as well. You would also look for the put sec in, I'm not sure to say that, I'm sorry. And you would also assess for hematoma cephalic, which would be blood in the brain, which it can be dangerous or fatal. Next, you would assess for temperature, pulse, and respiration of the baby. So first we will start with temperature, and you can do this under the armpit, auxiliary, or also rectally. Normal temperature for a newborn is 95.9 to 99.5. Pulse. Normal pulse is 100 to 160. And you want to listen for a full minute to assess for any abnormalities as well. Then you would assess for respirations. Normal respirations for a newborn is 30 to 60. And after that, you would assess the eyes. You would note the placement, any conjunctiva, the pupil fissures, and any discharge or drainage or anything like that. Next, the ears, you would want to note the placement, make sure that they are on the same, or they line up with the ears, or with the eyes. Next, you would assess the nose by doing a bulb syringe in the nose to check for patency. And then the mouth, you would want to don gloves and feel along the roof of the mouth to make sure that is formed correctly. Also assess for the sucking reflex as well. Next, you would complete the neck assessment, feeling for any bumps or masses. Also, you would check range of movement of the baby's head. Next, you would assess the skin, make sure there's no bruising, rashes, birthmarks, vernix, or anything like that. You note the color as well, which then brings you to the respiratory assessment. You would want to ensure that there is no skin color changes, any grunting, any wheezing, retractions, or anything like that. To check for measles, you can either listen, or you can, sometimes they are audible, or sometimes you can listen with a stethoscope, or if they're not audible, sometimes you can assess them with a stethoscope. Listening, you'd also want to listen to all lobes of the lungs and the heart as well. After that, you would complete an assessment of the abdomen, first inspecting the size and contour of the stomach. Next, you would listen to all four quadrants of the stomach, making sure there are vowel sounds or if there's any hypoactive or hyperactive vowel sounds, and you listen to all four quadrants for 1 minute. And then you would also palpate the stomach as well, noting any abnormalities. After that, you would complete an assessment of the umbilical cord and making sure that there's no redness and dryness or any discharge. After that, you can cover up the baby's top half and complete an assessment of the genitals. First, we will start with the assessment of the male genitals. And first, you would start by palpating the testes, locating the urinal meatus, also noting any rugae on the testes as well. For a female, you would describe the labia and then also note any discharge or lack thereof as well. Then after that, you can complete an assessment on the hands, the legs and arms of the recoil, making sure that they come back. Then you can assess the hands, noting any creases, making sure there's 2 on the hands and plenty on the feet. Count the 10 10 fingers and 10 toes. After that, you would want to complete the Babinski as well, the Babinski reflex, by swiping a tongue blade across the bottom of the baby's foot and assessing for fanning of the toes. Then you would wrap the baby back up and assess for the Moro reflex by lowering the baby's hands. Well, you want to have their arms out for this assessment. And by lowering the head, it assesses their fall reflex. You would also want to assess the last time they defecated and voided, the consistency, anything like that, any abnormalities in those. And that completes my assessment of the newborn infant.